Begin.
My name is Dr. Kalpana. I'm also junior doctor working in this department. May I ask your name and age, please?
Yes, my name is Mr. Scott and I'm 28-year-old.
Is it okay if I call you Scott?
Yes.
Nice to meet you.
Nice to meet you.
So how can I help you today?
Well, I have noticed today a lump in my testes.
Okay.
So I'm here to, maybe what's wrong with that? I've just noticed today.
You have done the right thing by coming to us. Don't worry, we are here to help you and we're going to look through it. Okay. So, as you told me that you are having a lump, okay? So, can you tell me, you have just noticed today, yeah?
Yes.
And have you noticed, have you seen it before? Anytime?
No, just today. I found this today.
In which testis you have noticed that?
It's on the right side.
Right side, okay. So have you felt it? Any hard feeling or soft feeling?
I don't know much it's like a lump. It's swelling, but it's not tender.
Okay.
It's not painful.
Okay, so it's not painful.
Yes.
Okay, so has it been increasing in size?
I just found it today, so that's
Okay.
the size.
So along with lump, have you noticed any discharge? Have you saw discharge from your front passage?
No.
Okay. Anything else you can tell me?
No.
Okay. Any weight loss?
No.
Any loss of appetite?
No.
Any heart race, dizziness?
No.
Okay, that's great. Okay, so has this happened before?
No. It's the first time I'm observing this.
Okay. Are you having any chronic medical condition?
No, I don't have it.
Okay. Are you having any medication?
No, not.
Are you allergic to any medication?
No, not.
Any family history for any lumps and bumps?
No.
Okay. Okay. By any chance, I missed one. By any chance, have you ever noticed have you ever diagnosed with any undescended testis in your childhood?
No, I was fine.
Okay, okay. That's great. Okay, so a few questions about your lifestyle, okay? So, do you smoke?
Yes.
Okay. Can you tell me what do you smoke and for how long?
I've been smoking for the last 10 years and I'm smoking like one pack.
Okay, I see. We will talk about it. Don't worry. So, can you tell me about your physical activity?
Well, I do activity, I do regular exercises and also I'm a mobile person.
Okay, does your work involve any heavy lifting or anything?
No.
Okay. So what we are going to do now, we are going to do examinations on you, okay? So we'll check your observations, head to examination, and especially we will check your, private area. Is that okay with you?
Okay, but okay. So you're gonna do that?
Yes, I will have a chaperone with me.
Okay,
Same-sex chaperone. Okay. So I will ensure your privacy. Are you comfortable with me?
Yeah, chaperone is there.
Okay, that's great. Okay. So my examination will involve looking at your private area, touching your private area, and feeling your lung. Okay, is that okay? Yeah. So I need you to be undressed below the waist. Okay, and you also need to lie down on your back. Is it okay? Okay. Yeah. Okay. So shall I proceed? Yes. Okay. So on inspection, I cannot see any scar, swelling, redness, discharge, or any hair loss, and on the genital area. And now I would like to inspect the penis. So can you lift up your penis for me, please? Yeah. Okay. Can you retract the skin for me? Okay. So I cannot see any retracted skin. And I would like to check the orifice. I'd like to check the urethral meatus. Okay. So can you retract the skin for me again? Yeah. Okay. So I can see the urethral meatus is intact. Okay. And now I would like to check your testes. Okay. So I would like to touch it. Okay. Okay. So I cannot see any swelling, spiking, or any redness or anything. So I will check the temperature first. Okay. So the temperature is not raised, or and now I would like to palpate. Okay, your testes. So at first I will check superficially. Then I need to palpate it deeply.
2 minutes remaining.
or discomfort, let me know. Okay. So. Okay. Now I'm going to palpate it deeply. Okay. Let me know if you have got any pain. Do you have got any pain here? Okay. Okay, so I have checked your private area. Now you can dress yourself, okay? And please make yourself comfortable, and we can sit and talk. Is that okay?
Yeah, fine.
Okay. So while I was, as you have given the history, and while I was inspecting and looking at your, testes, I found a swelling on the left testis. Okay, and it was a bit hard, and it was attached with the skin. Okay, so at this moment, what I'm going to do some blood test, which include routine blood test and AFP and HCG. But these are some protein to see if it's raised, and also I'm going to. I might need to, after consulting with my senior, I might need to refer you for a jelly scan, which is called ultrasonography. Okay. Is that okay? Okay, so I don't know at this moment what it is. So where after getting the report, I will be in a better position to tell you what you are having. Okay, are you happy with the consultation?
When are you gonna tell me about the reports?
Okay, so the blood reports, it will come within 1 week, and the ultrasonography report after consulting with my senior, it might take 2 weeks. Okay.
And what do I have to do in those 2 weeks? Take any medicine or anything like that?
Okay.
Move on to the next station.
Basically, just see if there is any change or any pain or any stretch.
Right here. You took an hour to take the history. Why did you do that?
If I don't take history, how I will know what is it?
Do you know now?
It looks like everything diagnosis from the history. But when I tasked it, it was fixed.
Okay. So do you know? Do you know now? Okay. What is your task? Read it.
Discuss the classroom treatment.
What does the scenario look like? Is it a combined station?
Yes.
Okay. In the combined station, you need to split your time. Okay. I will mark you 0 for everything, and there's absolutely 0. Okay. If I have to mark. Okay. Now, you guys need to split your time, divide the time into mini tasks. So there are 3 mini tasks. Okay. If you are spending the time for the one task dedicated for the other task, then you will be marked down. Okay. Even if you took that long history, it will give you 0 because you did not manage the time. You consumed the time that was dedicated for the other parts as well. Okay, and you do not know how to take the focus history. That is why you will get 0.
So what should I remove from my history?
Everything. Okay, just keep the question simple. The question should not be more than 7 to 10. There are 3 types of the history taking: focus history, detailed, and extended detailed. Okay, focus history is that you should complete within 2 minutes, including explanation of what you want to do in the next 4 minutes. Okay, that is a focus history. So, which means that it is quite extensive. You need to go, greet, check the identity, and confirm the presenting complaint, confirm everything. Then you need to ask a few questions. Then you need to explain what you want to do in the next 4 minutes, including the exposure and the position. So you got 2 minutes. Okay. How many questions you can ask? You need to figure out. So your clock should be running in your mind. Okay, you need 4 minutes, minimum 4 minutes to do a proper examination. There is minimum time. Okay, even then you may not be able to complete it. Then you need at least 2 minutes to do the conversation with the patient. Okay, so now you think about this. This is a combined station, 2 minutes, 4 minutes, and 2 minutes technique for all the combined stations.
So I can get rid of the like
I said you need to just get rid of everything that you asked. Okay, you ask only those things that will help you in making some or reaching some reasonable differentials. What you can ask, the question should be just surrounding the presenting complaint. Now I've seen bad thing in your practice, not your only, nearly everyone. Read the scenario again. All of you, read the scenario. Okay, now come. Now, when you start talking, you always start, how can I help?
yes.
Why is that? Does your station does not tell you why the patient has come? Okay, HOPI starts, yes, you need to start, how can I help you, this and that, okay. That is a valid question for the concerns where it says the patient has come with a concern. The patient has not told you anything. Okay, the patient has come with a testicular lump. Then why are you going to back to zero, starting from zero or even minus, wasting your time? You know this patient, Mr. Scott, has come with a lump. You need to confirm the presenting complaint, okay? Then confirm the patient's identity and the presenting complaint. Then you take the HOPI, and that is all about it. HOPI.
So instead of how can I help you, can I say, I understand you are here complaining about your lump. Can I?
Yeah.
Okay.
Yeah. What lump? Be more specific.
Yes.
Okay? Be more specific. Use that information. Okay? That information is given to help you. It is not the secret that the patient does not know and the GMC is keeping a secret from you. Okay? This is written something rubbish. This is to help you. Okay? This is what is happening with the patient. Go and find out why. Okay? So that is establish your starting point where you have to start. Okay? So you know that this patient has come with a lump in the testis. Okay? Which side is it? When did you notice any change in the size since it appeared? Is it painful? Okay?
I was confused till I asked because he said he has noticed today. So in case if the patient is saying that today, should we ask any change in size?
Yes. So is a wrong question?
This very can get increased in
Yeah, if it is,
It cannot get increased in a day.
trauma.
this is the first time he noticed. You don't know how many days it is there for, isn't it? Yeah. You could have asked since you first noticed in the morning. Okay. Do you feel that it has gone bigger? Can the size not change in few hours? It depends upon the nature. We don't know what is that. Isn't it?
Trauma
Yes.
is
Yeah. Anything happened around that time when you noticed it? Any injury, any trauma? Do you think? So just be more specific, straight to the point, okay? And ask the questions. Ask the questions only which are helpful. Do you smoke? Yes, it is helpful for this only. Okay? And any history of operation or any problem in the testis as a child. Okay? Any similar problem in the family? Any similar problem in the family now? Okay? And discharge, any bleeding, and sexual preferences you can ask. Then you move forward. Simply move forward. Okay, so Mr. Scott, let me quickly examine you, okay, to find more information on it. Okay. For the sake, I said you need to cover 2 headings. For the sake of examination and during this examination. For the sake of this examination, I need you to be bare below your waist and I want you to be standing. Okay? So I said you need to explain all the right things. Maria, could you stand here because I cannot see clearly. Okay? So all the right things. Right position, right exposure, right material. Okay? For the sake of this procedure, for the sake of this examination, and during this examination, during this procedure. Okay, so for the sake of this examination, I need you bare below your waist, okay, and I will perform the examination while you're standing. During this examination, I will be looking and feeling. Okay, that's all. I will make sure that I get the chaperone, maintain privacy. Now we are drifting, we are moving from pre-question to the prerequisites to the precaution. Okay, when you introduce a name, the word of the chaperone, you are by default you have entered about you started talking about the precaution. And during this procedure, if at any point you feel in discomfort or pain, let me know. So we are still talking about the precautions. We should not examine the patient when they are in pain. Okay. Does it make sense?
Yes, of course.
Alright. So after that, we need to examine the patient. The patient should be standing, okay? And we should be at the same level, okay? We need to look at the same level, okay?
So should we put it like
Yeah, we will focus on that, okay? There is no anybody at the moment. So, we need to see that at the same level, okay? When we are performing the examination, we need to start the inspection as we did with the breast examination. Inspection from the sides, come towards the middle, look around any lump at the base of the penis, any lump on the medial aspect of the thighs, any lump that you can see in the groin in the inguinal region. Okay, and any change in the pubic hair. Okay, then you do not need to ask. Do not ask the patient to pull the skin out and back and this. Okay, let's see. Yeah, yeah. Okay, so just tell the patient, I'm going to move your penis to, hold your penis, okay? That's all you need to do. He does not know which direction you want the patient to move, okay? So you can simply ask him, okay? Or if the patient is standing and you think that it's the only position that you want the patient to keep, then you can say, okay, would you mind keeping your hand here? Okay? Then we start looking on the testes, okay? Look for any loss of rugosities, any visible size, increase in the size, any visible lump, anything. Okay. On the front, then you want the patient that go. No, I'm going to move your testes slightly. Okay. No, you are looking behind. Okay, but do not go behind the patient. Okay, so you need to. The patient should be like this. Okay, you lift it and just try to look behind. You don't need to lift this. Okay? So, after this, based on whatever you find, you explain, you tell the findings to the patient. Okay? And then you feel it. To feel, again, we are going to use two hands. There is a lot of similarity. There is a lot of similarity in the examinations in the breast and this. Okay? So using two hands, you start the inspection from the sides. Okay? And from here, when you start palpating, start the temperature, then support with the hand. Okay? Try to feel. Okay? Are there two testes or one? Okay? So you need to feel. Is it one or two?
In deep position.
No. In general. Okay? So can you reach above? Can you feel any lump? Can you reach above the lump or not? Okay. And is it tender? So as I mentioned, if you find any lump, do not stop there. Move forward. Continue assessing. okay, until you examine. So until you have completed the examination, start feeling, support with one hand, start feeling, continue moving up, throughout, okay, yeah. Just put your hand behind and just try to feel with this, okay. Yeah, spermatic cord, and then you continue moving up.
So there's no superficial and deep palpation?
No, no. Okay.
And the patient will be standing tall.
Patient will be standing, but it depends what they do. Sometimes they put on the table, sometimes they hang it.
So get above the swelling is like this. Like
Yes, yes, yes. But you can simply,
just
you can feel it as well. Okay, you can do this. Okay. No, that is a special test. Okay, there is one special test. Okay, Prahen's test. Prahen's test. Okay, what you do is you put your hand underneath and ask the patient to tell you if the pain increases, what happens to the pain. Simply. Okay, so just say if I put my hands here, what happens to the pain? Okay, if I lift it. Okay, if the pain increases, it is no, no. It is a torsion. Okay, if the pain gets worse, it's a torsion. If it gets better, it could possibly be the epididymoarthritis or the varicocele. Okay, in the varicocele, you find the bag of worms. Okay, and epididymal, sorry, epididymitis, it is more the tenderness and swelling. They can be the orchitis, epididymoarthritis. Okay, in that you see, you can feel the spermatic cord is thick, okay, and tender. Then there may be hydrocele. What happens in the hydrocele? Can you reach above the lung or no? Okay. There can be the hernia where you can reach, where you cannot reach above the lung. Okay. If it's a hernia. In the hydrocele, you can reach above the lung because it's a loss of connection of the process vaginalis. Okay. The surrounding, the lower part makes a seal. Okay, makes kind of cyst. Okay, the upper part is that goes above.
transamination test.
Translamination, if possible, they may give you a paper, torch and a paper. Okay,
So we have to put the torch on the
yeah, and paper on the front. Okay,
So I should get it torch on the back and paper in there.
yeah. So you put the torch here, okay, and put the paper on the front. You do not need the full pound. You can simply just,
And the paper is, what is the purpose of the paper and all?
or just to avoid distraction so that you can see the way of focus.
The epididymal cyst will be in the posterior.
Yeah, in
It
the
is
upper posterior.
fixed. And it will be fixed or.
Yeah, it is fixed and it is fixed, soft, mobile.
It is separate, not separate. Cyst.
Yeah, it is.
Separate and cystic.
Yeah, most of
On the top.
the okay. There may be a blue dot when you do the inspection on the back, which is called the blue dot sign. Okay, there you see that on the posterior aspect. Okay, the blue dot sign. That is the torsion of the appendix of the epididymis. Okay, so there are two types of torsions in the testes. One is a testicle torsion, the other one is a torsion of the appendix of the epididymis. Okay, if it is a testicle torsion, if the branch test is positive, then it's a testicle torsion, and patient needs urgent referral. Guys, mic's muted, please, unless you want to ask me. Okay, if it is a testicle torsion, then patient should be under knife on the table within 6 hours maximum.
So blue dot is torsion of appendix of.
Epididymis. There is a blue discoloration.
Oh,
There
okay.
will be a
Blue
Discoloration.
discoloration.
on the
Okay.
posterior spectrum.
So when we are inspecting, we have to look into that.
Yeah.
Okay.
Okay.
That's
If
why
you
we
see
keep
a small localized blue discoloration, that is called the blue dot sign.
Okay.
Okay, that blue dot sign means that there is
Torsion
a
of
torsion of the
the
appendix of the
epididymis.
epididymis. That is managed conservatively. If it is a testicle torsion, it is managed surgically. Okay, no investigations, no CT or ultrasounds. Okay, it needs a surgical exploration and fixation.
Within 6 hours.
Yeah,
testicular
but
torsion, right?
testicular
Not the
torsion.
blue dot discoloration.
And you have to do cremasteric like.
Yes, but that is not the special test. I really don't care about that. Cremasteric reflex tells you more about if there is a neurological problem, neuropathy and stuff like that, or maybe you are worried about the conduct minor, yes, then you will do that.
And in any palpation, checking the temperature, should we check the thigh first, normal
Just-
first, and then
So you have the thigh here as well, you can touch those spots.
just like that? Just
Okay.
at
Yeah.
first thigh and coming to the.
Does not matter.
Doesn't matter.
Does not matter.
And first normal side or from pathological side.
Well, that is always the protocol, but here the sides are not far away, so there's scrotum is scrotum.
Okay.
And to complete your assessment, what you will mention that I will do the detailed examination, including the examination of the hernial orifices. Okay. Now, inguinoscrotal or hernial examination or the testicular examination is the same. Okay.
But we have to examine the orifices for the names.
You can start with this as well. It is only 10-20 seconds variation.
So
Okay.
in testicular examination, you have to do the check the hernia.
It is nearly the same. It is nearly the same. Okay.
We have to verbalize or we have to check it out.
So friends, test positive pressure of testicles, yeah?
Yeah. Testicles. Okay. It is nearly the same. Okay. Verbalize in that here you verbalize, but in that you should start by asking the patient to cough. Okay. You do the inspection while the patient is lying and while the patient is standing as well. And if there is any hernia which is projecting out, ask the patient
Reduce it.
to reduce it.
Cough.
Okay, reduce it.
Torsion of the appendix. Cough for for
Torsion of the
Keep it general. I think
Is there any funding
in this.
in this?
Yeah, this is
Then we don't have to ask to retract the skin. I mean, if it is there is skin, we have to ask them to retract. For
if there is skin, then you mention
we
that
can
I
do
yeah,
ourselves.
yeah. Mention that I just want to, but make sure that after you complete, you retract back. Okay. Any question? Now about the management. Okay. The management for this patient is you refer the patient to the urology if you're concerned. Okay. Urgent, immediate referral if it is a testicular torsion. Okay. Urgent referral, the 2 weeks referral if there is a none. Okay. In the meantime, always good practice to warn the patient of the red flags. Okay. And do the blood investigations.
When we asked you what am I supposed to do in the 2 weeks time, so what was the ideal answer for that?
The ideal answer in that during this period of time, I would say sit at home, relax, okay, just keep look out for the symptoms. If your symptoms get worse, give us a call. Otherwise, we will contact you. Okay. In the meantime, I'll make sure that I book an appointment for your blood test and do the blood test. Okay. If your symptoms change, If they become worse, if you notice any other lump, call me. Okay?
Okay.
Alright? We need a break now.